Anatomy book, page 348, chapter 13, is the blood. So we're going to talk about what's in the blood, why are they in the blood, how is it made, and then, of course, diseases of the blood. Okay. So I think this is a great image to give you an idea of like the overview of the whole chapter, and then we're going to talk about all of it. So if we take a blood vial from a patient, we can put it in what's called a centrifuge, which spins it. And what happens is that the blood will separate like this. And 55% of your blood is plasma, mostly the plasma proteins, okay, with a big part of it being water. Then we have the formed elements, which is 45% of the blood, which are your red blood cells. And then that middle is called the buffy coat, which are your platelets and your white blood cells. Okay? So we're going to talk about all these plasma proteins. We're going to talk about all these white blood cells and what they do. And we're going to talk about, of course, those red blood cells as well. So it kind of gives you an idea of what belongs where. You may have heard of people donating plasma. You can see that that's just that top part of the picture. It's those plasma proteins. These are really important in your blood, but it does not contain any red or white blood cells. Because of that, it is not blood type specific, meaning that if I donate plasma, any person can have that injected into them, which is great if you need plasma proteins. It does not do you any good if you need blood due to blood loss, like in a surgery or a trauma. So we're going to start here with the blood plasma, which are all those plasma proteins. We have albumin, globulin, fibrinogen, and prothrombin. Albumin retains water in the blood. So that one basically says, hey, water, stay here. Okay, so it keeps that water component of your blood, which makes it the consistency that it is. Globulins are helping protect you from infections. And then fibrinogen and prothrombin together are both necessary for the blood clotting process. I had a student many years ago who put these together as PFAG, and that is actually how now I think of it. If you were to say to me, Miss Becky, what are the plasma proteins? I immediately would go PFAG, and then I would go, and I got to think, prothrombin, fibrinogen, albumin, globulin, and I'll come up with it. But if I didn't do that PFAG first, I could not just randomly come up with those words. Now, you can use that. You can come up with another way of doing it. You could do FGAP. You can come up with any phrase you want, as long as if I say to you, what are the 4 plasma proteins, you come up with those 4 words, whatever it takes. Okay? In the human body, we do have about 5 liters of blood. 2.6 of it, or almost half, is plasma, and 2.4 is the formed elements, which are the white blood cells and red blood cells. All right, so now we're to the formed elements. So the red blood cells, that's all you need to know is red blood cells. We'll talk about the use of a red blood cell later in the chapter. However, the white blood cells have a whole bunch of different kinds. There's granular and there's agranular. The granular are neutrophil, eosinophil, and basophil, and the agranular are the lymphocytes and the monocytes. Guess what? We're going to talk about all of that a little more. And then also the platelets are in there as well. So what is the purpose of all of these types of cells? Your red blood cell is for oxygen transport. Your red blood cells carry the oxygen. So we've already done the heart chapter, so you know that the blood carries the oxygen out through the body. Well, it's the red blood cells that actually do the carrying. The next one are the granulars, which are these three together. How do I remember these? I call them the benphils. Okay? Because baso, eosino, and neutro are the ben, and they all end in the word phil, P-H-I-L. So I call these the benphils. And once I get the benphils in my head, I can come up with baso, eosino, and neutro. But again, if I don't go to benphil first, I won't get to there. Okay? The neutrophils are for immunity. The eosinos protect you against parasites. And the basophils are used for inflammatory and heparin secretion. Then we have the agranulars, which are your lymphocytes. We'll talk about later about the T cells and the B cells. Monocytes, which is again for immunity. And then the thrombocytes, which are the platelets, are for clotting. The B cells and T cells we actually won't talk about until we do the lymphatic chapter, which is your immunity chapter. We will talk about it this mod, but not this chapter. So we talked last module, for those of you who were here, freshmen, I know you didn't hear this, I'm going to repeat it. We have the word hematopoiesis. Med term hemato means blood, poiesis means formation. So hematopoiesis is the formation of blood. Okay? And that's where our red blood cells and our white blood cells are being created. Some people have issues with their blood cells, and we can do bone marrow transplants because it's the bone marrow that actually creates the blood. So if we give you new bone marrow, hopefully the blood cells will be made correctly with that new bone marrow that you've had transplanted. Okay, so now we're going to talk about red blood cells. Red blood cells, what do they look like? Well, it says here that they are caved in on both sides, where there's a thin center and a thick edge. What I call a red blood cell is a junior mint. If you think of a junior mint, it's caved in on the side just a little bit, and it's circular. And that's what I think of a red blood cell looking like, is a junior mint. So it's a circle, and then on the sides, it's like caved in just a little bit. The red blood cells, you have between 4.2 and 6.2 million in every cubic millimeter of blood you have, which means you have a huge number of them. The purpose of the red blood cells is to carry the oxygen out to our body. So we have a lot of them. Okay? The red blood cells have no nucleus. They are not alive. Okay? Because of that, they cannot reproduce themselves, and they cannot be repaired if they are damaged. Because of that, a red blood cell only lives about 80 to 120 days. Then your body will reabsorb the old ones and create new ones. So it's just like your dead skin cells that keep regenerating and your skin kind of flakes off, but your red blood cells have nowhere to flake off because they're on the inside. So your body will reabsorb them, in the spleen actually, and then there's new ones to take its place. So obviously, if they're only living 80 to 120 days, and you have this massive quantity, 4.2 to 6.2 million per cubic millimeter of blood, your body is constantly reabsorbing the old ones. This process is normal. Now, we can do a test called a hematocrit, abbreviated as an HCT, and that is counting your red blood cells. It's giving us this count of how many you have in any given sample. Hopefully, the patient is within that normal range. We also can do, that doesn't talk about it here. Oh yeah, it does here. The hemoglobin, this is where it gets really in depth into chemistry, and you don't have to memorize all this chemistry. But the hemoglobin, which is another blood test we can run on the patient, is counting or measuring the amount of oxygen that is being carried by those red blood cells. Because that's obviously the point of the red blood cell. So if it's not carrying the oxygen properly, our body isn't getting what it needs. And you do not need to memorize all these terms, but they talk about the oxygen in the blood as the oxyhemoglobin. Okay, you can see lots of chemistry stuff here. You don't have to memorize these, or the carbaminohemoglobin. Yeah, I get tripped up on the words too, just like you guys do. All right, so what can go wrong with the red blood cells? A normal red blood cell is about 7 to 9, I'm not sure, meter is what that stands for, okay? And it could be small, it could be too small, too big, it could be too quantity, too much of them. Okay, blood typing. This is where I'm going to cover the blood typing, and then we're going to move on. I'm going to start a second video so that you don't have to do this all in one sitting. Okay. So do you know your blood type? Many Americans don't, but it's about probably 50-50. So usually when I ask in my class, about half the people put their hands up that they know their blood type. And mostly people don't know their Rh factor either. And that's the Rh is simply the positive or negative that goes at the end of your blood type. Okay? We're going to talk about all that. So what blood type you are depends on antibodies and antigens. And so what kind of blood type do we have? What exists in the first place? We have type O, type A, type B, and we have type AB, which is a combination. And antigen, these definitions just kind of get my goat sometimes. But an antigen is a substance that stimulates the body to make an antibody. Okay? But an antibody is defined as a substance made by the body in response to stimulation from an antigen. Still doesn't really tell us what either one of them are. It just says that this one makes this and this is made by this. Okay, great, but that doesn't give us a very good definition. Antigens are present in our body, and they are looking for ways to protect our body. And the creation of the antibody is how it decides to protect it. Pretty much. I know it's still kind of a strange concept. What happens is that if you have a type A antigen, like you do right here, you have to have an anti-B antibody. Or the anti actually stands for antibody, so it's like antibody B. Okay? Notice you can't have a type A antigen with a type A antibody. They cannot exist in the body together. So then type B blood has a type B antigen with a type A antibody. It's opposite of each other. If you have both A and B antigens in your blood, you can't have either antibody. Because remember, A and A can't go together, B and B can't go together. So if you have A and B antigens, you can't have either antibody in your body. And if you have no antigens, you can have both antibodies because the antigen-antibody combination isn't happening. Okay? So I always think of this as like friends. Friends and friends of friends. But if you're having a party, if you're going to invite antigen A to your party, you can't invite antibody B, because those two people at a party together is disaster. But if you're going to invite antigen B, then you can't invite antibody A, because those two people can't go together. But if you're going to invite antigen A and B, you can't invite either one of these people because of disaster. But if you don't invite these two people, then you can invite these two people, because they cannot exist at the same party. They cannot exist in the same blood sample. If you need a blood transfusion, we need to give you the correct blood type so that we don't introduce the incorrect antibodies into your body. If we put a correct blood type into your body, this is normal blood, where everything's all spread out. That's normal blood. But if we introduce the wrong blood type into your body, they will start clumping or like clotting inside. Your entire blood supply will do this, and it will kill you. So we can't give you the wrong blood type. Okay. Notice that this person can only get this. If you give them any of these kinds, you'll kill them. Because you're introducing the wrong kinds of antibodies and antigens into the environment. But notice this person who has no antibodies, you can give them every kind of blood. And they'll be fine. So if I tell you I'm AB, you can grab any bag of blood from the blood bank and I'll live. So an AB blood is known as the universal recipient, means I can receive anything. Type O is considered to be the universal donor. We look at your O, O can be received by anybody and live. So they're the universal donor. So we love O blood type people to donate blood. Even better, O negative. Those are like the prize unicorn in the world of blood donation. All right, the RH system. The positive and negative at the end of your blood type is known as the RH. The RH is actually named after a rhesus monkey, R-H-E-S-U-S, rhesus monkey that we discovered it in. That's where the RH comes from. It's just named after him. Okay? With the RH factor, when you're negative, again, it's an antigen-antibody combination problem. And if you have an RH negative patient and you introduce RH positive blood into their system, you will create a reaction. And the biggest problem of this RH is pregnancies. If you have an RH negative mother and an RH positive father, and the creation of their baby creates an RH positive baby, you now have a negative mom with a positive fetus. That's a problem. If we were having this conversation 100 years ago, that's why they did blood tests before marriage 50, 60 years ago. And they would caution these two people to not get married. You are going to have problems having babies. Now, you could still get married. Nobody's going to tell you otherwise. But we don't get blood tested anymore. So obviously, we now have a fix to this problem. What happens is when you have that RH negative mother and that RH positive baby, the baby's fine. Baby's born just fine. but that baby leaves behind some positive markers in mom's blood. And mom gets pregnant with the second baby, who's also Rh positive. Guess what happens? Mom's body kills the baby. Now, mom gets pregnant with a negative baby, they're fine. But remember, the Rh negative mother used that positive fetus as an invader. And the body wants to kill invaders. We kill germs every day in our body. We kill the invaders, right? So it sees that fetus as an invader. First baby's fine. Second baby is not. Third, fourth, fifth baby is not. Okay, however many babies you have. Now, this is not a problem today. And many of you who are watching this video who may be Rh negative and have had a baby, you already know where I'm going with this. We have what's called RhoGAM. It is an injection. Mom will get this during pregnancy, and they'll get it right after giving birth. And what the RhoGAM shot does is it counters that Rh positive marker the baby's leaving behind in the mom, which means that the next baby will be fine as long as mom gets this treatment. So it's very important for prenatal care for mom to know their blood type and to know that they are that negative. Any blood type, as long as you're negative, you need this treatment. And without it, you could have problems in the future. So if you think back to your own family tree, for me, it's my grandmother. For some of you who are younger, it may be your great-grandmother, great-great-grandmother. If you saw miscarriage after miscarriage after miscarriage, this is likely the problem. Because in those days, first of all, they didn't know about blood typing, but they certainly didn't have treatment. The condition of that attacking of that fetus is called erythroblastosis fetalis, which is that miscarrying of that baby due to the Rh factor. Okay, I'm going to end video 1 here, and we will pick up with the red blood cell disorders on the next video.